Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, a 72-year-old woman presents with a T-score of -3.4 on her bone mineral density (BMD) test. Her medical history includes a low-trauma vertebral compression fracture from a minor fall last year and a recent wrist fracture after slipping on ice. Which classification best describes her bone health status? A. Normal. B. Osteopenia. C. Osteoporosis. D. Severe osteoporosis. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice D, severe osteoporosis. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Going back, D is the correct answer as the patient meets both criteria for severe osteoporosis. 1. T-score below -2.5. The patient's T-score is -3.4, which falls well within the osteoporosis range, significantly below average, as shown on the bone density T-score table. A T-score of -2.5 or lower defines uncomplicated osteoporosis. 2. The presence of one or more fragility fractures. The patient has a history of a vertebral compression fracture from a minor fall and a recent wrist fracture from slipping on ice. These are classified as low-trauma events resulting in fragility fractures. The quick tip states that vertebral compression fractures and Colles wrist fractures, a common wrist fracture, are the most common fragility fractures seen in severe osteoporosis. Because the patient has both a T-score of -3.4 and multiple fragility fractures from low-trauma events, the condition is classified as severe osteoporosis. These types of fractures are classic presentations of severe osteoporosis, where even minimal trauma can result in bone breakage. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because a T-score of -3.4 is well below the normal range of above -1.0, and the presence of fragility fractures clearly indicates compromised bone health. Answer choice B is incorrect because osteopenia is defined by T-scores between -1.0 and -2.5, and this patient's T-score of -3.4 is significantly lower than this range. Answer choice C is incorrect because while osteoporosis is defined by a T-score of -2.5 or lower, this patient's condition has progressed beyond uncomplicated osteoporosis due to the presence of fragility fractures. The fractures elevate the classification to severe osteoporosis. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.